name is Brooke Armstead, and I'm going to be performing the task basic first aid. The first scenario is a fracture. So what's happened is this dog has come in and her front left leg is obviously fractured. So what we'll do is, just because a dog in pain could always bite, we're going to go ahead and apply a muzzle. So I'm just going to slip it on from behind. Buckle it in and tighten it. And then we need to get her onto a table. So I'm going to use this blanket as a makeshift stretcher. So carefully I'm going to just move it to where we can, in one motion, move her onto the stretcher. Hang on, girl. Hang on. So, 1, 2, 3. Girl, stay. And then we'll lift the stretcher and get her onto the table. Ready? 1, 2, 3. So now that she's on the table, what I'll do is I'll take this spoon splint, which is plastic, so we could actually shoot an x-ray and it won't show up. And I will try my best to stabilize this fracture. I'm trying to keep it as stable as possible. I'm going to apply the spoon splint and wrap the cast bandage. This isn't going to be on there very long, and I don't have to worry about making it very tight because it's not about pressure, it's just about stabilizing the leg. Okay, so now what I'll do is I'll contact my doctor, and if he wants me to go ahead and start pain meds or set up for x-ray, we'll do those things, but we'll just wait for him. Okay, the next scenario is bleeding. So this patient has come in and she has a wound on her front left leg that is bleeding significantly. So both me and our strainer both have gloves on, because just in case this is like human's blood, we don't want to have any blood contact. So the first thing I'll do with this wound that's right here on the leg is I'll take gauze and I'll just apply. The second scenario is bleeding. So what's happened is this animal has come in and she's got a significant wound on her front left leg. There's a lot of blood, so the first thing we did is put on gloves, because just in case this is human blood, we don't want any blood content. So any dog that has a wound could be in pain and could bite. So the first thing I'm going to do is my strainer's going to hold what she can, and I'm just going to slip this muzzle over just in case. Snap it into place, tighten it up. And so the first thing I want to do to a wound that's bleeding a lot is apply a gauze and pressure, just to see if I can use pressure to stop the bleeding. And after about 3 minutes, I'm going to lift that, and if we're still bleeding, I'll try a pressure bandage. So the purpose of this bandage is obviously pressure to stop the bleeding, so it can be pretty tight. It's not going to be on there long. So I'll apply that bandage pretty tight like that. And then after about 3 minutes, I'm going to check that again to make sure we've stopped bleeding. If we're still bleeding through that, as a last resort, we will try the tourniquet. So with a tourniquet, it definitely needs to be the last resort, but we will slip it onto the leg. We will place it between the wound and the body and tighten it up. And because we don't want to cause any harm to the body, we're going to check this, or we're actually going to loosen this for about 20 seconds every 15 to 20 minutes. Like I said, this is definitely a last resort. And in the meantime, we're constantly calling our doctor, seeing what's the next step, and he's giving us further instructions. So the next scenario is a burn. So this patient has come in with an obvious burn on its front right foot on the top. So if this is a chemical burn, the first thing I'll do is definitely wear gloves, because if it can burn her, then it could probably burn us. So my restraining and I both have gloves on. Just because she could be in pain, we're going to go ahead and apply a muzzle. So very calm over the back of her head. I'm just going to slip the muzzle, snap it in place, and tighten it up, just in case to keep us safe. So I'm immediately going to start running cold water over this burn and just flush it out. So that's what we would do if it was a chemical burn. If this was a severe burn, then what we'll do is we will apply a cold compress. And we'll just wrap that up, and we'll wait for instructions from our doctor. So the next scenario is choking. So this dog comes in and she may be like pulling at her mouth, like maybe there's something stuck in her mouth, or she may just not be breathing well, and the owner suspects she's choking. First thing I'm going to do is I'm going to check her mouth. I'm going to check her mucous membranes, and they look pale to me, so obviously she's not getting enough oxygen. So the first thing I'll do is I'll open her mouth and look for any visible obstructions. If it's safe and I see something, I can reach in and try to take that out. I don't see anything, so the first thing I'm going to do is try to dislodge whatever may be stuck. So to perform the Heimlich maneuver, I'm going to find the end of her rib cage right here. I'm going to go just below that into her abdomen and place my hand, and I'm going to place my other hand on top of it. And what it's going to look like is basically like this. And I'm just going to try to move big gusts of air up and try to dislodge whatever may be stuck.